Hello guys, today we are going to be talking about anti-arrhythmic drugs, which were my personal nightmare. I couldn't remember which drug belonged to which class, or I would always forget the side effects of the drug. Before we proceed further with the anti-arrhythmics, I want you guys to know a little bit about the cardiac action potential. So this is the action potential for the cardiac myocyte. Okay, this is myocyte action potential, and this is the action potential for SA node and AV node. It has 4 phases: 0, 1, 2, 3 and 4. I would mostly forget the numbering of the phases, which phase comes at which point. First aid gave me this mnemonic: plateau means 2, phase 2 is plateau. So based on that phase, I could easily number the stages. So 2 is plateau. If this is 2, then this will be 1, this will be 0, this will be 3 and this will be 4. In addition to that, what happens during these phases? Phase 0 is depolarization. 1 is repolarization. Phase 2 is plateau. Phase 3 is also repolarizing. This is initial potential. So what is happening during these phases? Phase 0 depolarization, sodium channels open. Phase 1 repolarization, there is potassium efflux. Phase 2 also potassium efflux, but then calcium influx is also there. Phase 3 is again potassium efflux. Phase 4 still potassium efflux. This is what's going on in the cardiac myocyte. This is how the action potential proceeds. Phase 0, phase 1, phase 2, phase 3, phase 4. The initial phase is all sodium entering. The later 3 phases is mostly potassium exiting, but there's also calcium entering here in the plateau phase. That's all you have to remember for the cardiac myocyte potential, right? For the pacemaker potential, you can see the phase 1 and 2 which we had in the myocyte are missing. There's just phase 0, and instead of 1 and 2 which were there, you directly have phase 3, right? So 1 and 2 are absent. There's phase 1, phase 0 and there's phase 3. So what's happening over here? Phase 1 there's calcium entry, phase 3 there's potassium exit. So always remember, whenever there's like a down slope like this, there's always potassium efflux over here. Depolarization is either caused by calcium or sodium, right? So here the depolarization is by sodium, here the depolarization is by calcium. So phase 0 calcium channels, phase 3 potassium efflux, phase 4 funny current. Funny current is basically sodium entry and potassium exit, both are combined over here. Let's proceed with anti-arrhythmic drugs. Try to study it as combination of 2 and 2. This is easier to read, okay? So class 1 and 3 I'll combine together. Class 2 and 4 will be combined together. Okay, so I have a mnemonic for class 1 and 3. Let's review that. So class 1, salty cab driver's snack ride. Okay, he ordered fries please because he heard Queen die after eating sugarcane. Then he stopped for little Mexican tacos for his depressed heart. This is the mnemonic which I have created after combining some of the sources, Dirty Medicine and the comments below, and then I added my own twist for this. We will proceed with the order of CAB, cab, right? The cab driver's cab. So C is the strongest class and B is the weakest class. And you know, salty means sodium, right? Salt is sodium. So this is sodium channel blocker, right? So CAB. So the fries please, right? F and P, flecainide and propofol. Fries please because he heard Queen die after eating sugarcane, right? Queen is quinidine, di is diisopyramide, and cane is procainamide. Next is little Mexican tacos, that is lidocaine and mexiletine. Depressed heart is cardiovascular depression. Okay, and after a meal, good meal, you have sedation, sleepy effect, right? You feel sleepy. This will cause CNS depression. Now let's talk about the side effects. C is contraindicated in MI, can't use. Okay, C, can't use in MI. B, best for MI. Right, this is all you have to remember for these two classes. Now let's talk about the middle class, that is quinidine, diisopyramide and procainamide. Quinidine causes synchronism, die, you can die from a rhythm, right? So there's QT prolongation, that is torsades, and procainamide will cause drug induced SLE. So if you remember these parts of class 1, that's more than enough. This is the strongest, this is the weakest. Fries, please, you have flecainide and propafenone. Queen die after eating sugar cane. So queen die cane, right? And little Mexican tacos. Lidocaine, mexiletine. Depressed heart, it will cause CNS depression, and tacos will make you sleepy. That is CNS depression, right? So you have completed class 1 drugs. Now let's look at class 3 drugs. Class 3 drugs is lol till I die amigos. Lol is sotalol. Till I die. Till I die. So that is ibutilide and dofetilide. Right? Amigos is amiodarone. We'll discuss more about amiodarone drug a bit later. And whenever you see die over here, right, these classes will cause torsades. So you can say class 1, class 1A and class 3, both of them will cause torsades de pointis, right? So now let's see the antiarrhythmic drugs in the same order, that is class C. Fries, please. Flecainide, propafenone, fries, please. Strong channel blocker. Adverse effect is 1C is contraindicated in ischemic heart disease, that is MI, right? That is the only thing you have to remember. Antiarrhythmics name mein you have it, that is it will stop arrhythmias, right? So the SVTs including atrial fibrillation. What are SVTs? That is arrhythmias above ventricles. Supraventricular, no? It is above ventricles. Refractory VT mein it is the last resort. So you don't have to remember that, just remember the the class name and the adverse effect. These are the most important here, right? So you have completed class 1C. Now let's come to class 1A. Quinidine, procainamide and diisopyramide. Queen dies after eating sugar cane. This is moderate, CAB. This is moderate, right? There's synchronism, there's SLE, there is torsades de pointis. In addition to diisopyramide causes heart failure, right? And then you have B, lidocaine and mexiletine, little Mexican tacos. So these are the weakest, best for post-MI. It will cause CNS depression and cardiovascular depression. That's it. Now you have completed most of the things which have been mentioned here after reading this one mnemonic, right? Now let's proceed with class 3. Class 3 mein you have sotalol, ibutilide, dofetilide and amiodarone. The most important one you have to remember is amiodarone. Okay, so I have made a mnemonic for this. It's in the tune of Twinkle Twinkle Little Star. So it goes like this. Ignore my voice. Amio, rhythm's friend, keeps the heart in steady trend. C for corneal, halos are bright. A for alveoli, lungs are tight. D for thyroid, low or high. C for color, skin turn shy. H for hepatic, watch those tests. Amiodarone needs those careful checks. This is how I remember amiodarone, right? It affects so many systems. And one more thing you have to remember is amiodarone. The name itself has iodine. This iodine can cause two things. There's excess of iodine provided in the body because of amiodarone. So excess iodine means it can shut off the thyroid hormone, or it can activate too much of iodine, right? Too much activation. So shut off. If it shut off, it is will shake off. So it shuts off, and this is John based on. Okay, so this is hypothyroid, this is hyperthyroidism, right? So this too much of iodine will either shut off or increase too much of thyroid hormone production. So hypo or hyperthyroidism it can cause, right? The corneal micro deposit will appear as cat whiskers. So before administering amiodarone, you have to do pulmonary function test, thyroid function test and liver function test, because more than 50% patients will have, will definitely have adverse effects of amiodarone. So that's why you have to check for all these tests before initiating amiodarone. Let's see class 3 first. So you can also remember class 3 drugs as AIDS. I find it better as lortilidimigos. This dye, right? So it will cause torsades de pointes. In addition to that, amiodarone is the most important. Pulmonary affected, hepatic affected, thyroid affected, right? There's corneal deposits, there's skin deposits, then neurological, then cardiovascular effects. You know, anti-arrhythmic slows heart rate and everything. That's why there's heart blocks also. Remember to check PFT, LFT and TFT when using amiodarone. And one more thing you have to remember is amiodarone has class 1, 2, 3 and 4 effects. It is a combination of all class F. Amiodarone is like the jack of all trades. It acts on each and every class 1, class 2, class 3, class 4 effects. It has all different kinds of effects. That's why when you have an arrhythmia, you prefer amiodarone over other drugs. So we have completed class 1 and class 3, correct? Now we will go ahead with class 2 and class 4. Class 2 is beta blocker and class 4 is calcium channel blocker. Okay, B is the second letter, that's why beta blocker is class 2. Calcium is here. So if you see this order, first will be sodium, then will be potassium. Class 3 I have forgotten, it is potassium channel blocker, then will be calcium, right? First will be sodium, then potassium, then calcium. But we are missing beta blocker because beta blocker will act on the pacemaker over here and not this. That's why B is the second letter, so it is class 2, right? So this will be class 1, this will be class 2, this will be class 2, this will be class 3 and calcium will be class 4. If you go and look at it in this order, this might be helpful, or just remember it as I have said, class 1 and 3 are together. Next is beta blocker and calcium channel blocker. So beta blockers, before we proceed further, we should know a little bit about beta receptors. Beta 1, so you have one heart, right? Beta 2, you have two lungs, and heart and kidneys are both in the same system, that is they both control the blood pressure. So we talk about it in the one system kind of thing. So heart and kidney will be affected by beta 1, two lungs will be in beta 2, right? In addition to that, smooth muscles are also in beta 2. Beta 3 will be nitric oxide release. When there is beta blockade, first effect, most prominent one will be your heart. So in heart it does many things, that is it decreases heart rate, contractility, it decreases AV node conduction, and it decreases cardiac output. Okay, so this decreasing heart rate and contractility will help increase preload and arrhythmias also, and decreased heart rate will decrease oxygen demand, correct? And that's why it will help in angina, MI, heart failure, and also HOCM. Because HOCM, how do you improve HOCM? By increasing preload. So decreased heart rate and contractility will increase preload by increasing diastolic filling time, and hence you can increase the preload. That's why HOCM is also improved with beta blockers. Okay, arrhythmias, SVTs, that is supraventricular arrhythmias, can also be improved with the help of beta blockers, and decreases cardiac output by it helps hypertension and portal hypertension, that is varices. This is the important effect in the heart. Now let's talk about the kidneys. What happens in kidneys? Normally it increases renin, right? In kidneys it increases renin, which will increase blood pressure. Now when beta receptors are blocked, it will decrease renin, which will decrease hypertension. Next, let's talk about smooth muscles. Okay, there are smooth muscles in blood vessels, smooth muscle in lungs, correct, and there are smooth muscles in penis. Okay, now normally beta receptors will cause dilation. Okay, so instead of dilation, when beta receptors are blocked, it will cause constriction. So blood vessels are constrict, that is vasoconstriction, which will exacerbate peripheral artery diseases, Raynaud's, right? Lungs में beta 2 means 2 lungs, right? You have 2 lungs and it will cause dilation, right? So it will cause bronchodilation. Now here the lungs will have bronchoconstriction. This will exacerbate COPD. Next we'll talk about penis. Penis में normally to have an erection of penis, you should have adequate blood supply. So how do you get increased blood in the penis? By dilation, vasodilation, right? So now what's happening here? Constriction. So there is decreased blood flow and this will cause erectile dysfunction. Another thing you have to remember is it decreases glucagon. This will cause hypoglycemia. Why hypoglycemia? Because glucagon, in the name itself you have glu, that means glucose. So glucose increasing hormone is glucagon, right? So how do you increase glucose? Gluconeogenesis. So gluco is glucose, neo means new, genesis is synthesis. So glucose synthesis, right? Gluconeogenesis. Then comes lipolysis. Lipo is fat, lysis is breakdowns. So it breaks down fat and creates products which help utilize energy. Next is glycogenolysis. So by name itself you can know it breaks down glycogen, right? From glycogen it produces glucose. So when there is no glucose production, right, all these pathways are decreased. This will cause hypoglycemia. Now when there is hypoglycemia, it will activate sympathetic nervous system, right? This will increase epinephrine and norepinephrine, correct? Now this epinephrine and norepinephrine should increase the glucose, right? These hormones are increasing glucose. But now what's happening is these will act on beta receptors and increase heart rate and tremor and anxiety and sweating. So these will happen after epinephrine activates beta receptors. But since this process is blocked, right, beta blockers are blocking this process, you won't feel any of this. That's why you will have masked hypoglycemia. In addition to that, when beta is blocked, right, beta is blocked, there will be unopposed alpha-1 action. This will cause vasoconstriction. These are the effects of beta blockers. Now let's see about beta blockers, the class 2. You have the OLOLs, right? A to M are selective beta blockers. The beta blockers which start from letter A to M, the first half. Okay, beta 1 selective. Next, N to Z are non-selective, right? Now we know that they decrease activity of SA node and AV node by decreasing phase 4. Beta has 4 letters, that's why it inhibits phase 4. And obviously you will have heart blocks. Use is in rate control. Side effects we have just discussed because of the constriction, right? There's decreased blood supply in the penis, that's why impotence. Bronchoconstriction instead of dilation, that's why exacerbation of COPD and asthma. And cardiovascular effects, you know, it decreases heart rate contraction, that's why bradycardia, AV block, heart failure, right? Masked signs of hypoglycemia because epinephrine will act on beta receptors which are already blocked, and hence there's no signs which will indicate hypoglycemia, correct? exacerbate vasospasm and vasospastic angina because of unopposed alpha 1 action, and in addition to that they are causing vasoconstriction, right? Now how do you treat beta blocker overdose? With saline, atropine and glucagon. So we are done with class 2, class 1, class 3. Now we are left with only one of them, that is calcium channel blockers, correct? So it has in its name calcium. 1, 2, 3, 4, 5, 6, 7. That is 7 letters. 0 plus 3 plus 4 is 7, right? So it inhibits phase 0, phase 3 and phase 4. Another thing you have to remember is calcium channel blockers are divided into two classes, dihydropyridine and non-dihydropyridine. So in this class you can see this D. So it dilates and the names end with dipines, okay? And this non-dihydropyrimidine. So calcium channel blocker, what does calcium do? Contract, right? Contractility, right? So this will mostly affect the contractility. This will affect the vasodilation, because D for dilation and D for dipines. So the examples of dipines will be nifedipine, nimodipine, nicardipine, amlodipine, right? And the examples of non-dihydropyridine, diltiazem and verapamil. So if they ask something like which one is the most effective dilator among these, right? So you will always go for dihydropyridine, not pyrimidine. I keep saying pyrimidine. I don't know why, but it's pyridine, right? Dihydropyridine more than, you have dilator, dil is dilator, right? So next comes diltiazem, next comes verapamil, okay? And if you ask about controlling the heart rate or contractility, verapamil will be more than diltiazem, because more than dilating property, it has contractility also, right? So diltiazem will be there. Then we have dihydropyridine, okay? This is the order for the heart rate and contractility. Now if you see this vasodilation, right? This vasodilation, and this will cause peripheral edema, okay? So this will cause peripheral edema, and because calcium channel blockers decrease the contractility, right, you will see constipation among these guys. Vasodilation causes peripheral edema, correct? In addition to that, when there is vasodilation in your face, it will cause flushing, and in your head it will cause dizziness. These are the side effects of calcium channel blocker. Most important ones are peripheral edema, constipation, and another one, there's no logic for this, I don't know, I just remember it as it is, the gingival hyperplasia. That's all for the antiarrhythmics. So if you see over here, this is where there is calcium entry, this is where there is potassium exit. So this part is delayed. So there is delayed conduction velocity, and the adverse effects are constipation, gingival hyperplasia, flushing, edema, cardiovascular effects, because it will depress the heart rate and sinoatrial node. Correct? So these are the most important antiarrhythmics you have to remember.